Mr O'Connor.
Milady, may we please call Dr. Ben Warner?
Just repeat after me. I do solemnly,
sincerely and truly,
declare and affirm that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
Dr. Warner, do take a seat. Could you give us your full name, please?
Ben Warner.
Dr. Warner, you have kindly prepared a statement at our request, which is up on screen, and it runs to some 80 or so pages. I know that you've read it through before you came here today, and there are a couple of very small amendments that you want to make to it, which I'm not going to ask you about because they really are very minor indeed. But with those amendments having been made, are you confident that the contents of this statement are true to the best of your knowledge and belief?
Yes.
Thank you. Dr. Warner, you are by training a scientist, are you not?
Yes.
In fact, you describe in your witness statement that you took a PhD in molecular physics.
Close enough, yes.
Thank you. And that having obtained that qualification, you undertook postdoctoral research at the Engineering and Physical Sciences Research Council.
That's the title of the research fellow. The fellowship was at University College London.
Thank you. And thereafter, and we're on or about 2015 now, you worked for a data science company run by your brother, Mark Warner. Is that right?
Mark co-founded it with a number of other people, and he is the CEO, yes.
And you worked there?
Yes.
We don't need to go into the detail of your work there, but you refer in your witness statement to machine learning being one of the matters, at least, that you focused on at that stage.
Yes.
And you also say that in parallel, so at the time after 2015 that you were working with your brother, you were also advising both government and also the commercial sector on data science, artificial intelligence, matters like that.
As part of my work as an employee of faculty, I advised government, FTSE 100 companies and 250 and fast growth startups, as it says in my witness statement.
I see. So it was at that time, but I was perhaps wrong to say it was in parallel. It
Yes.
was part of your job.
Yes.
Thank you. So moving forward a little bit in the chronology then, you say that you were recruited to work at number 10 immediately following the December 2019 election.
Yes.
Is it right that you were recruited by Dominic Cummings?
The conversations I had were with Dominic Cummings, yes.
And the purpose of your employment, the whole idea was that you would try and push forward the use of analysis and technology in government, drawing, no doubt, on the experience we've just mentioned.
Yes.
It is right, isn't it, that you had worked on the Vote Leave campaign a year or so before the 2019 election?
Yes.
And is it right that you therefore knew Dominic Cummings from those days?
Yes.
Presumably you also knew Boris Johnson as well.
No.
Had you not come across him during the Vote Leave campaign?
I believe I had never spoken to to Boris Johnson during the Vote Leave campaign.
Right. And just to finish off on the start off of, as it were, of your experience in Downing Street, you describe in your statement that you were, as a matter of formality, a special advisor, but you emphasise that it wasn't your role to advise on political matters in the way that we might normally expect of a special advisor. Indeed, you say you had no expertise in the wider Westminster political ecosystem. Is that right?
I mean, how I've described it in my witness statement is probably the most precise I can be.
Yeah. Is that a fair summary that I've just given?
Yes.
Tell us this. When you started your job then in December 2019, how were you expecting it to develop? What were you expecting to be engaged on during your time at Downing Street?
I treated it like any other engagement that I've done previously. Often companies that lack expertise in these areas understandably don't know the best way to move forward. So the first part of it was just to learn the sort of state of the landscape at that point in time.
Of course, we're all conscious of the dates, and within really a month or two of you arriving in Downing Street, the pandemic began, and a large amount of your time, not all of it, as you explain in your statement, but a large amount of your time was taken up with matters relating to the pandemic, in summary.
I think that over the early period that is true, but towards the later period that would not be true.
Yes, and just to be clear, you in fact left Downing Street in May of 2021.
Sorry, I was referring to the later period of my time in Number 10, not the later period of the pandemic.
Yes, so it's right that you left Downing Street in May 2021?
Yes.
So just the point you made, the early period, but you mean, shall we say, the first half of 2020?
Yes.
And then your involvement from later on in 2020 and early 2021 was reduced?
Yes.
Thank you. Now, let's talk then about that period for the first half of 2020. And just by way of context, you describe in your witness statement in the very early weeks of the year being engaged in other projects. Of course, you probably, I think you say you had heard of the pandemic starting in China from the scientific press, but it wasn't a matter of everyday concern for you in early January. You refer, for example, to working on the HS2 project during that period.
Yes.
But you did, quite shortly thereafter, become involved in the day-to-day response to Covid-19. And it may have been that exercise Nimbus, which took place on the 12th of February, was the first occasion when you, as it were, had a formal involvement in the sense of an appointment in your diary requiring you to undertake something to do with the pandemic.
Yes, my calendar, especially over that early period, probably is not a great reflection of my activities. But like you say, the first calendar that we can show is definite COVID is that that Nimbus exercise.
And as we'll hear, and we'll come to this in a bit more detail, after that, so after the 12th of February, you started to attend scientific committee meetings, for example, SAGE, but I think, as we'll hear, there may have been other committees as well. And so the rhythm of your involvement increased over that period.
Yes.
And your statement describes, and this is really one of the themes that I want to explore, how you became convinced that the mitigation strategy, which we've all heard about, and which was being pursued at the time, was flawed in the sense that as the understanding of the pandemic developed, you became convinced that it would lead to the NHS being overwhelmed, which would itself cause greatly increased fatalities. Is that right?
I became convinced the mitigation strategy was the incorrect one, yes.
And was that at least partly to do with the fact that it would cause NHS overwhelm?
Yes.
Thank you. So as I say, I'd like in a moment to review what you were doing, what took place, the notes you made during that period, with that being at least one of the issues we focus on. Before I do that, I wanted just to raise a couple of short introductory points. The first, can we go to paragraph 95 of your statement, please, on page 27? And it's the sentence or two at the beginning of that paragraph, Dr. Warner. You say it's not necessary to perform large-scale simulations of an epidemic to understand the main effects of a mitigation versus a suppression strategy. Simple calculations allow for reasonable approximations of the outcome, and I would have been carrying out calculations of this type. Now, we've heard a lot of evidence, Dr. Warner, about modelling, and we've heard about how complicated and, if you like, inaccessible other than to experts, those modelling processes can be. Are you trying to make the point here that one can understand in broad terms things like the difference between the mitigation and the suppression policies, strategies, without actually needing to undertake complicated modelling?
Yes, I think as discussed in my statement, I'm really talking about reasonably simple epidemiology. Yeah,
and just to give a sort of example of the point which you may well be trying to make, can I ask you to look at an email, please? And just to make this clear, this isn't an email that you were party to at the time it was sent. The inquiry has already looked at it. It was an email sent in January, on January the 25th, by Professor Woolhouse,
yes,
who the inquiry has heard from, to Neil Ferguson, who I know you knew at around this time, and also Sir Jeremy Farrow. And we see here that he is sharing with them some concerns that he had at that early stage about COVID, and asking himself the question, how bad is it going to get? And referring to what he describes as two key numbers, which he'd seen in the WHO statement, that is R, the reproduction number, yes,
yeah,
being 2, and the case fatality rate of 4%. He also refers to a generation time, which he said he could make a guess at. And then he says, perhaps if we drop down 2 paragraphs, he refers to some arithmetic which, as he puts it, his undergraduate class could work out with a pocket calculator in a few minutes. And then the paragraph above, what that arithmetic is, he says if we take those numbers at face value, we quickly get to a ballpark estimate of almost half the people in the UK getting this infection over a year or so, at least a doubling of the gross mortality rate, much more during the epidemic peak, and a completely overwhelmed health system. Now, those, of course, were his ballpark calculations, but is that the type of rough calculation that you had in mind in that paragraph of your statement? You were...
Yes, I'm almost certain he's referring to the same equations that I'm talking about.
Right, yes. And so we can see there that those sorts of equations give you if you like, a ready reckoner on likely mortality rates, the likely period an epidemic may last, or a pandemic, and the impact on the NHS. Is that fair?
I'm not sure how you get the timescale of the epidemic, but the other two are true.
Right. Thank you. Let's move on then and look back at your own personal involvement. We can do that, if we may, by going to paragraphs 32 and 33 of your witness statement to start with, on page 11. And we've touched on this, but you describe it. It's at 33 where you say that the first, as it were, diarised event was this Nimbus exercise. In the paragraph above, you say that you very likely came across COVID in meetings or discussions before that, but you can't pin that down now. So Nimbus, on the 12th of February, you refer to being an observer there. And it was, as we have heard, a ministerial tabletop exercise. Do you remember where it took place?
In Cobra.
Right. And as you say, the objective was to expose ministers to decisions they might be expected to take during a pandemic in the reasonable worst case scenario. Now, we've heard something about that concept of a reasonable worst case scenario. What did that term mean to you, or does it mean to you?
At this time, or now?
At the time.
At the time, in this meeting, actually, I can't tell you what I thought it meant.
Well, let me put it this way. I'm sure you knew that this was supposed to be a, quote, reasonable worst-case scenario. And that's in the slides and is discussed. We will see was discussed at the meeting itself. So did you understand that the scenario being discussed was something that was predicted as likely to happen, or as something that might happen, perhaps the worst sort of
I
end
can't.
of the spectrum, or do you not know?
I can't speak to that.
All right. Let us go then to some of the documents that are associated with the Nimbus exercise. And to start with, perhaps we can look briefly, because we did look at this document at the end of last week, at the briefing pack, which is 52022. I'm sure you've looked at this document recently, Dr. Warner, but do you remember seeing it at the time?
Yes.
Let's go, if we can, first of all to page 7, where we see what's described as the synopsis. And we will note, and we did look at this at the end of last week, first of all, the first bullet point, the notional date was the 14th of April, so they were projecting it 2 months ahead, because we know that the exercise was actually on the 12th of February. And then there were various details given about what is supposed to have happened by then and what is forecast. And we can see the penultimate bullet point, 8,500 deaths to date. However, there's a lag in data, a case fatality rate of approximately 2.5% of clinical cases, 1.25% of the total population. And in terms of actual numbers, we see in the last bullet point, it's expected 840,000 excess deaths over the 16-week wave of the infection, assuming there's that term we discussed, the reasonable worst-case scenario. Those, of course, are very high numbers indeed, aren't they?
Yes.
And they must have made an impression on you at the time.
As I say in my statement, most of my reaction is in hindsight. I mean, it was a fictional exercise.
A fictional exercise which was just dealing with a very extreme set of factual events.
I don't remember more than I put in my witness statement.
Okay. Let's just look at over the page, the last page on this document. This summarises the position in graph form rather than in the bullet points on the page before. We see, don't we, a fairly familiar type peak. Most of it is projected because the April date when the exercise was supposed to be taking place was still in the, as it were, the foothills of the development of the pandemic on the scenario at Nimbus. Is that fair?
Yes.
We see the line. And you say in your witness statement that you knew this anyway, but looking at this peak, it's clear that what is contemplated is some form of mitigation strategy, because you don't see any sense in which the wave is being suppressed, if that is the alternative strategy.
Yes, I do say that. It's important to recognise that I do say that in hindsight. I don't remember what I was thinking at the time.
I see. All right. Let's go on, if we may, to another document, which in effect is a set of minutes from the exercise, although I'm not sure one actually sees that term used in this document. Just to be clear, this is actually a document which you exhibited to your statement along with very many others. I didn't raise it at the end of last week and suggested that we hadn't seen a document of this sort. In fact, it had been disclosed and we did have it. So let's look at it now. First of all, could I just pick up on the timing, Dr. Warner? You may or may not remember much about this, but it's quite noticeable that the exercise started at 6, can you see, that's right, 16:45, so 4:45 in the afternoon. Do you have any memory as to how long it lasted? If it started at that time, one might think it wouldn't have lasted more than an hour or two, but can you help us at all?
No.
No. Let's look on then, please. We see a list of attendees that Matt Hancock was in the chair. If we go over the page, please, we can see your name on the right-hand side. Yes? And then I'd just like to take you to one or two references, starting on page 3, please, the first numbered paragraph. We see that the exercise was started with what's described as a current situation update, and a little more detail is given about the notional situation than we saw in the slides. So, for example, we can see an estimate that there could be as many as 1.6 million further cases in the week on which the notional exercise was taking place. And if we go over the page, we see, just again to give us a sense of scale of the type of emergency that was being exercised, paragraph 3, DCMO emphasised that the week beginning the 13th of May may be the peak week. 7.3 million new cases would arise in that week, not including those who had not yet recovered. The expectation was that over the course of the pandemic, there would be 33.5 million clinical cases. So, as I say, putting some numbers to the broader outlines in the slides. Clearly, if you like, a population level pandemic was being contemplated. Yes?
Yes.
And then if we just look further down that page and onto the next couple, we can see that the discussions seem largely to have focused around how such an enormous series of infections were to be dealt with by the various different parts of the state that were represented at the meeting, in particular the NHS. And so, for example, at paragraphs 7 and 8, we see being picked up the point that was raised towards the end of last week about the NHS needing to triage by resource, as it's put, so not having the capacity to triage or to treat everyone that came through the door, needing to use their resource only on some people. Paragraph 11, reference to the fact that there would be competition for beds between new patients and old patients. Do you see that? Can I just ask you, do you have much of a memory of this sort of discussion at the exercise, Dr. Warner?
The first thing I'd say is that I don't these minutes. I'm not sure I saw at the time. I think if they were referenced in my witness statement, it was a reference to show that I was there rather than because I have these notes. My recollections of the exercise as a whole is contained within my statement. That I remember thinking that it was a serious, obviously a massively serious threat, and that I didn't think this stress tested the government's plans in any serious way. Yeah. Past that, I don't have any extras.
All right, well, I'll just take you to one more reference, just in part so that my lady can see it. If we can look over 2 pages, please, to page 6 at paragraph 28. Continuing the theme, really, there's a reference to the Home Office noting the social consequences of these decisions, effectively rendering it into a, quote, survival of the fittest situation. What we certainly seem to see from these minutes, Dr. Warner, and I appreciate you're saying that this isn't all in your memory now, but do you agree that, at least looking at these minutes now, it is apparent that what is being discussed is a disaster, a sort of medical disaster, which either, in fact, involves the NHS collapsing, or at least a situation which is very close to the NHS collapsing?
Yes, in this hypothetical scenario, everyone is discussing that.
Yeah, I mean, if you're talking about fighting over beds and survival of the fittest and so on, that's, in truth, where you are, isn't it?
Yes, in this hypothetical scenario.
Hypothetical, absolutely. May I direct you to another document, please, which is document INQ 56150, which is a CRIP, and we've been taken to page 14 of it, which is the page I wanted to go to. And these are the lessons learned, or at least some of the lessons learned from exercise Nimbus. Let me ask you this, did you see this document, do you think, at the time?
I can't speak to it.
No. Well, let me just show you it, and just casting our eyes over the types of lessons that are identified here. Looking on the column numbered 1, policy issues for further discussion, we see, for example, 3 bullets down, mental health support for those involved in strategic decision-making of Covid-19, consideration of possibility of public unrest, and if we zoom out, we would see that there are other similar considerations in the other columns. For example, at the top of the second column, a need for the moral and ethical advisory group to advise on the types of decisions that might need to be taken. The point I wanted to make about this, Dr. Warner, and ask you about, is that there's plenty of consideration of unrest and difficult decisions to be taken, but there doesn't seem to be anything about the fact that the NHS might be collapsing and trying to do anything to stop the NHS collapsing. Do you remember at all, either at the meeting or afterwards, any discussion about the fact that what had been discussed at the exercise seemed to be a series of events involving the NHS collapsing?
I don't remember conversations in the room. As I put in my statement, I just remember it just being overall not a serious attempt to stress test the government's response.
What do you think it might have needed to take place if it was going to be such a serious attempt?
I'm not an expert at wargaming, so I don't think I should speak to that.
Well, in general terms, I mean, you say it wasn't a serious attempt to stress test the arrangements. What would you have wished to see, or do you really not?
I think that it's not. I'm not an expert in crisis response. I don't know the right way to do emergency planning or how to stress test these responses. This is the only meeting of this type I've ever sat in. Therefore, I can say to you my opinion at the time, but not necessarily the right way to do it.
No, but your opinion at the time was that it wasn't a very effective or deep exercise.
Yes.
Let me switch back to this mitigation strategy that was in force at the time, and which and ask you about your understanding of it. In very broad terms, the purpose of or the effect of the mitigation strategy is this right to allow the virus to run through the population in order to acquire herd immunity. Right, okay so far?
Carry on.
Well, let me carry on. Where the peak of the pandemic, the peak of the curve is reduced so far as possible to mitigate the death toll, but not so much as to prevent the population acquiring that herd immunity. There's an extra element I want to add, which I know appears in some of your documents rather later in the chronology, and that is the need, perhaps, to prevent the NHS being overwhelmed. Did you understand back in February, at the time of Operation Nimbus, that preventing the NHS being overwhelmed was a critical part of the mitigation strategy?
At this point in time, no, I do not think I did know that.
Well, do you think that, applying a certain amount of hindsight, do you think that, in fact, that was the policy at the time, or do you think perhaps it wasn't?
I don't know what the policy at the time was.
Did it appear to you, at least from the Nimbus exercise, that the need to, or a need to stop the NHS being overwhelmed was in fact at the top of people's minds during that exercise?
I think from the Operation Nimbus slides, you can clearly see that a mitigation strategy is the one that the government is pursuing. Why it is pursuing that, I think, is not in those slides, and I do not remember further discussion on that.
See, let me just ask for your reflection on this. One explanation for the fact that, as far as we can see, the exercise doesn't really seem to have grappled with trying to stop the NHS being overwhelmed, either in the minutes of the meeting or in the lessons learned, maybe that it was regarded as something that was perhaps inevitable, or at least it couldn't be stopped, and so there was no need to spend time worrying about it. Do you think that might be an accurate description of the view at the time?
I think that it's clear from the numbers in those graphs that are presented that in the reasonable worst case scenario, the NHS would struggle, and I believe that is actually in the Nimbus slides. Whether people saw it as inevitable or not, I don't know. At that time, I'm not sure I would have formed a view.
No. Well, that's very fair, Doctor, and let's carry on with the chronology then, if we may. Let's look at your witness statement first, and at paragraph 39, please, on page 12. You describe here, Dr. Warner, that as you were leaving Cobra, where the exercise Nimbus had happened, you had a conversation with Patrick Vallance, in which you suggested that you should start to attend SAGE meetings. He thought it was a good idea, and thereafter you did regularly attend SAGE meetings.
Yes.
Why did you suggest that you should attend SAGE meetings?
I thought that it was a good idea for me to have a better scientific understanding of the pandemic.
Did you feel at the time that you might be missing something, or did you just think, this is now obviously serious, this is somewhere where I can get more involved?
I think that it was about making sure that I had a clear understanding of the current scientific evidence.
So SAGE meetings you then attended regularly. I think, in fact, the first one was the next day. If we can look just to carry on with this theme at paragraph 44, which is over on the next page, thank you, we can see that you, only a week or so after that, you started attending Cobra meetings as well.
Yes.
You also refer to civil contingencies meetings separately from Cobra meetings. What were they?
I don't know.
No. They may have been sort of occasional ad hoc civil contingencies meetings, perhaps.
I believe this might be a quote from the email.
Right, I see. And then, I'm not going to take you to passages in your witness statements, but you, is it right that you also attended, first of all, SPI-M meetings?
I believe I did attend SPI-M meetings, but not to the same frequency of SAGE.
I see. And what about SPI-B meetings? You do refer in your witness statement to having a meeting with SPI-B. I'm not sure whether you meant that you were a regular attender of their meetings or not.
I believe I had a couple of conversations with James Rubin. I don't think I ever attended SPI-B.
All right. But in any event, it's fair, I think, to say that from around this period, you did start to attend these series of meetings that we've just discussed, certainly SAGE, Cobra, and some SPI-M meetings.
Yes, although I'm not sure about SPI-M before the, say, March 23rd. My memories of SPI-M is post-lockdown.
And can we take it that your scientific training meant that you were able to engage with, understand the discussions at these meetings?
Yes.
Were you welcome at them?
Yes.
Did you act as a conduit between the scientists in these meetings and Number 10 and the people you work with there?
It's fair to say that, I discussed things with the scientists, but I was also aware that it was important that I did not speak for Patrick or Chris in their roles as CSA or CMO.
One of the sort of systemic issues that the inquiry is looking at is how well the system of passing information and views from SAGE and the other committees, on the one hand, up to the decision makers in Downing Street worked. And we know that a very key part of that was Chris Whitty and Patrick Vallance. So did you see yourself as being an extra means by which the information could pass from the committees up to Downing Street, or did you in fact make sure that wasn't the case?
I did not see myself as an extra means. Obviously, by listening to SAGE and talking to scientists, I had an informed view, and I participated in conversations.
Did you feel at the time that there was, in fact, any sort of shortfall, a deficit in the way that information was passing between the committee meetings up into Downing Street?
Throughout the pandemic, I thought that there was a lack of scientific capability within the different teams and groups that I was working with.
Just pause there for a moment. Do you mean a lack of scientific capability on Sage or in Downing Street?
I know. Sorry, I meant for that was generally across government. Obviously, the people on Sage are very good at what they do. They are very thoughtful scientists, and as I say in my report, I spent time talking to them to make sure I was as informed as possible as to their views.
So as I interrupted you, you were saying that you did think that there was a lack of scientific understanding across in the government departments you were working in. In
general, and also within this specific instance, I do think that that within the let's call it sort of Cobra/Cabinet Office, that I was continually concerned about their understanding of what Sage was saying and how that was being translated into the documents that were produced for ministers.
Are you able to give us an example of that sort of concern or episode?
The reason I speak to that is because I sent an email to that regards just after lockdown for specific instances, and now I can't speak to it.
All right. Thank you. We may come back to that issue in due course, but let's take the chronology forward a little bit and go through towards the end of February. Now you are attending regular Sage meetings, and it's right, isn't it, that the picture about how the virus was taking hold in the country was becoming clearer during this period. In particular, it was that the view of Sage that sustained community transmission was present, was hardening during the latter half of February.
I don't think that's true.
Tell us.
I think that 2nd of March, SPI-M say it's likely and it's almost certain over the next 2 weeks, but I don't know if that's true over the mid to late February period.
All right. I think there was some. I don't disagree with your what you say about early March, but I think there were some earlier references in February where less strong views were expressed on SPI-M. But be that as it may, the view that certainly the picture was becoming clearer during February. Do you agree with that?
I think that I think that's a difficult statement to make without looking at the evidence.
Let me ask you a different question, which is this time not about the development of the pandemic, but about the question of the NHS and whether it was likely to be able to cope with whatever was coming down the line. Now, the evidence we've heard from a number of scientists on Sage and also on SPI-M, as you know, many of them doubled up, was that it was becoming clear during February that the NHS was likely to be overwhelmed at the peak of the pandemic. For example, Professor Medley used very much those words. He said, throughout February, it became increasingly clear that NHS capacity in the UK would be overwhelmed. Well, you were at the Sage meetings, perhaps not the SPI-M meetings that early. Is that something that you picked up from those meetings?
Apologies. Are you talking about the reasonable worst case scenario or a central forecast?
A central forecast.
I'm not sure there was a central forecast at this point.
No. Well, that's rather the point. It may be that it wasn't set down as a central forecast, but it was the view that was being formed by the members of the committee. You were there. I wonder whether you picked that up in discussions at the time or not.
I have no memory of that, I'm afraid.
Because one of the issues with both certainly SPI-M and Sage is that the consensus statements that emerged and were then passed on to Downing Street and other government departments perhaps didn't capture the full depth of view being developed on those committees. Now, to take this as an example, this is something that we asked Professor Medley about, because we looked at the SPI-M and SAGE minutes, and they didn't reveal the type of view he was expressing about the NHS during February. Do you think, either in that instance or others, that the consensus statements, the minutes, didn't fully reflect the discussions being held?
I don't know if I was seeing the minutes at this point, and I also don't remember the minutes at this point.
Do you have any memory at all of a developing view about whether the NHS would be able to cope with the approaching pandemic during February?
I remember discussions about the sort of developing evidence around the virus, about whether, obviously case fatality rate is not the number that matters, right? It's the infection to fatality rate. And that is a hard number to estimate. And I remember people talking about that, talking about the fact that actually it was like there was asymptomatic transmission. I think that a large number of these numbers, once, as you pointed out at the start, put into these simple equations, you would then infer that the NHS would be overwhelmed. But I do not think I ever saw a central forecast at this time.
Well, it's very much that sort of soft inference rather than a hard-edged forecast that I want to ask you about, Dr. Warner. But let's come on. Let me take you to a few of your documents relating to this period. We can actually start by going to paragraph 52 of your statement. So it's paragraph, yes, we have it there. And you refer at the bottom of the page to a SAGE meeting on the 27th of February. Do you see that?
Yes.
And you refer there to the planning assumptions. In the reasonable worst case scenario, 80% of the UK population become infected with an overall 1% fatality rate. Now, your notes of this meeting you have provided, and perhaps we can look at those. It's 215664, please. Perhaps we could just introduce these, Dr. Warner. I'm going to take you to a passage in this notes in a moment, but you have, I think, you had a habit of keeping a notebook with you when you were at meetings, and you obviously kept them, and in preparing your statement you've gone back to them and done the best you can, because we don't always see dates on the pages, to identify which notes refer to which meetings. Is that right?
Yes.
And so if we can go to page 17, please. You say in your statement that, having done that exercise, that you think these are the notes that relate to this meeting on the 27th that we were just discussing.
Yes.
First of all, at the top of the page, we see case fatality 2%, infection rate. Do you mean the infection fatality rate there of 1%?
I don't know. I mean, that is my note.
Or it's the overall fatality rate of 1%, which you've referred to in your witness statement. In any event, just looking a couple of lines down, can you see the reference to 80% infection and 40% symptoms?
Yes.
Does that suggest a discussion about asymptomatic infection at that point?
Looking at that, I think that this is a discussion of the reasonable worst case scenario.
Yes. But help us. Is the distinction between a certain proportion with infection, and a lower proportion with symptoms? Does that suggest there was a discussion about asymptomatic?
Apologies. What I meant by that was that it's likely that the document that's being talked about at that time will refer to this. So rather than going to my notes, I would suggest that document will give you actually what it was. But yes, I agree with that this is saying that probably half the people infected show symptoms and the other half are asymptomatic, yes.
Yes. Well, obviously, one of the things the inquiry is interested in is how early on in the chronology of all of this, asymptomatic transmission was being taken seriously. Help us. Is this something you think that was discussed as something that was likely to be happening, or something that only might be happening?
I can't speak, that clearly, but I believe that the asymptomatic transmission was always part of the conversations of COVID. However, obviously, human memory as it is, but this definitely points to that as well.
All right, thank you. And then just lastly on this page, let's just look towards the bottom. Yes. So we see in square brackets there, NHS fucked in any scenario. Do you see that?
Yes.
And I'll ask you about that, but before I do, can we go over the page? Because there's one other reference, which may be driving at the same thing, or it may not be. Do you see 4 lines down? It says long peak over health capacity.
Yes.
Now, help us. It would seem, at any rate, that both of those references, perhaps, are to concerns about the NHS being overwhelmed.
I believe that it says this in the reasonable worst case scenario document that Sage is discussing. They say that in these reasonable worst case scenarios, the NHS is overwhelmed.
Yeah. Perhaps we can go back to the previous page. Your note talks about the NHS being fucked in any scenario. Is there any significance in the word any? I mean, are you...
I believe it's probably, and I would suggest that the document that Sage is discussing is the way to investigate this. But what I would suggest is that it is likely that, as we've seen multiple times, that the graph is drawn with an unmitigated peak, a mitigated peak, and maybe multiple mitigated peaks, depending on the interventions that were brought in at that time. All of those are likely over the top for the reasonable worst case scenario.
So that it's the various sort of modelled or proposed peaks that are the any.
I am guessing, given the what's in my witness statement and what's in my notes, but that does look to be the obvious conclusion.
Let's look back, just for completeness, Dr. Warner, at paragraph 56 of your witness statement, because you explain what you think you mean about these notes there. So it's on page 17 of your witness statement, paragraph 56. Thank you. You fairly say you have no independent memory of the conversation at the meeting. And then 4 lines down, you say the bracketed statement about the NHS likely means that in any scenario, and I think what you've explained today, you mean in, as it were, any of the worst case scenarios that were under discussion, the NHS will be under extreme stress. Is that what you mean?
Obviously, in my notes, it says any. Today, I've given my best guess as to what any likely means. And yes, that's what I mean. You had an exchange, may even have been on the same day. It was on the same day. Could we have a look? Yes, it's been brought up. Thank you. If we look at the bottom first, this is an exchange of emails with Patrick Vallance after the meeting that we've just discussed. You say, in the Sage meeting today, I was a little concerned the NHS didn't seem to know what they needed for their models and didn't seem to have started modelling. Did you have the same feeling? And if we go out and look at the response, Patrick Vallance responds almost immediately, yes, I've been pushing them on this for the last 10 days or so. I think Stephen Powis, who is senior member of the NHS in England, has now grasped it. And they say that they've been doing a lot of modelling, but the problem is they haven't defined the input variables well enough. But he thinks it's on track. Looking at this exchange, and indeed at the meeting, Dr. Warner, so we're now over 2 weeks after exercise Nimbus, and the modelling
is still in its early stages, variables haven't been agreed, it might be thought that not enough was being done to grapple this rather obvious problem of the risk of the NHS being overwhelmed. I'm not criticising you, but help us. You were there at the time. I mean, clearly from your email, you're suggesting that they need to get on with it. Did you in fact think, why haven't they done this already?
My memory of these meetings is not complete enough. I think that email clearly shows that I'm concerned about the NHS's modelling and whether we have a full picture of what will occur in the NHS at that time.
Let's move forward a week or so, Dr. Warner. Let's look at paragraph 87 of your witnessing on page 25. And you've transcribed the notes that you made at that meeting, so we don't need to go to them. But here, this is I think it was a Sunday, the 8th of March, the Sunday before the rather eventful week that followed.
Yes.
So you're attending a meeting on a Sunday, which perhaps demonstrates how urgent matters were. But picking up again on this point about the NHS overwhelm, you say on that occasion, still case NHS supply always overwhelmed. And then in the paragraph below, you say, I was making the point that in any documents that decision makers were considering, it had to be clear that in a variety of scenarios being considered, the NHS would always be overwhelmed. So has something changed, Dr. Warner, by this stage? Is it still the question of, well, it's a worst case scenario, it's one of a few worst case scenarios? Or is the position now, in your mind at least, this is something that's actually going to happen?
It's difficult to say precisely because we're moving through a time when there is developing scientific evidence and people's opinions are increasing in confidence about what the likely, let's say, their central forecast is for each of these different groups. Obviously, at this point, I'm becoming increasingly concerned. And so I think what I'm trying to say here is that in the documents that are going to decision makers, there is usually some sort of reference to it, but that unless you sort of draw attention to it, that this will clearly happen, it is, and that's what I'm trying to say here, is that in the variety of scenarios being considered, I believe this is still reasonable worst case scenario, that it is very clear to the decision makers that in these scenarios, the NHS will be overwhelmed.
By this time, certainly according to Professor Medley, it was a common understanding. He says his understanding, and he said that it was shared with a number of other people on his committee, that the NHS would, not as a matter of worst case, but a matter of likelihood, be overwhelmed. Had you picked that up by this stage, or were you?
I think at this point, I obviously have developing concerns. I believe that across a range of issues, the issues about is mitigation the right strategy is one of them, for obvious reasons, though the actual uncertainty around the IFR, even at this point, the infection fatality rate, even at this point, I don't think is, I think that the estimates were probably between about 0.25% and 1%, around on about this date.
Let me take you to another document, Doctor, and that this involves going forward to the end of that week. So it's 196052, please. Now, this is a document you drafted. It's not dated, but you do refer to it in your statement as a document that you started drafting on that Friday, the 13th.
Just to flag, this is a draft from part of that document. There is another, the same document, which is a later draft that's also in there.
But is it right that this captures your thinking on the Friday the 13th?
I would suggest the later document is probably better, but I'm also happy to use this document, yes.
Well, we've got this one on screen, Dr. Singh. If you tell us if there's an important difference.
The summary is different because it contains the fact that herd immunity is going to collapse the NHS.
Well, let me ask you just about 2 paragraphs that are in front of us, and you can tell us whether they remained in the final version and explain if they changed. But starting at the top, you refer to the fact that the government had chosen to follow a mitigate strategy. This means we're aiming to build herd immunity by late autumn. And then you go on to say the consequence of this is that we're not completely locking down our population to stop the epidemic, but we're simply trying to reduce the effect of the pandemic to a level that the NHS can cope with. And if we look down, we've actually got enough on screen, you refer a couple of paragraphs down to the alternative plan, the suppression model, and then 2 paragraphs below that, you come back to the theme, which is that for this plan to work, that's the mitigation plan, it's crucial that the NHS does not collapse. So, at least on this draft of this document, in that week, it's clear that you understood that the idea of preventing the NHS from collapsing was an integral part of the mitigation strategy. So I wanted to come back with this in mind to the question I asked you earlier. Is that something that a view you had sort of developed or formed by the 13th of March? In other words, or was it actually always your understanding that preventing the NHS collapsing, lowering the peak to a level below NHS capacity, was always part of the mitigation strategy?
I believe at this point we've published the action plan, where I think it likely talks about this, but I can't say with certainty. And also there was obviously, I believe, a press conference where it was discussed.
Well, I'm not going to get it. The action plan doesn't certainly refer to this in terms. But see, one possibility, we can all see that as a matter of political reality, it's simply not politically feasible to have a response to the pandemic which involves the NHS collapsing. Do you think it's possible that over time, and that by the 13th of March, that sort of political reality had to be factored in to the mitigation scheme, even if perhaps it wasn't understood several weeks earlier?
I think your political feasibility I can't speak to, but it is worth thinking about, considering the fact that there might be viruses in the future that have a reproduction number that is high enough that you can't suppress it in the way that we did, that actually a lockdown would fail. So that is, I think, something to recognise, that this isn't just about politics. There's actually, real world events that change how you have to react to a virus. As to this document, as to whether the NHS collapses or not, obviously at this point I see it as crucial. Obviously at this point that I understand that if the NHS does collapse, that it brings with it people die who did not need to die.
Just following on from that, first of all, bearing in mind what you say about this being a draft and there's a later version, was this a document you drafted for yourself or for other people to see?
This, I believe, is something that I began drafting with the idea of trying to persuade others that our current strategy was not the right one.
And did a further draft of this document go, for example, to the Prime Minister?
In my witness statement, I talk about the document I've drafted. I also discuss another document that was drafted on the Saturday, which I think is clearer and talks to the same views, that was, I think, we had the intention of sending more widely. However, on August the 15th, obviously, Neil Ferguson sends through a paper which more rigorously says exactly the same points. Also, Angela McCain sends a paper to Sage that says similar points. So we didn't actually need to rely on my not brilliant English and communication, or the other documents. We could rely on the scientific advisor's documentation to provide the evidence as to why we needed to change strategy.
But August the 15th.
Sorry, if I've misspoken, I meant March the 15th. Thank you.
Just a few final questions, Dr. Warner, on this theme. We've got to the 13th of March, which we've heard from many other witnesses was a key moment. Can we look, please, at paragraph 122 of your statement, which is on page 35? This is your summary, Dr. Warner, of where you think, in your mind, things had reached on the 13th of March. First of all, you say the epidemic was further along. That is, there were more infections and numbers growing faster than had been anticipated. That was a development that took place at the SAGE meeting on the 13th of March, a revised estimate from the modellers, wasn't it?
Yes, I believe that they felt that the doubling time was not 6 days, but 3 days.
And then the capacity of the NHS was not going to be close to sufficient. So here, at least, you're no longer, correct me if I'm wrong, talking about a worst-case scenario. You're talking about a likelihood, a probability of what was or wasn't going.
Yes, I'm discussing the forecast of how the disease how the pandemic will proceed, not a planning assumption.
And are you able to help us with how much before that date this view of yours had hardened into a view about actuality rather than a worst-case scenario?
On the 8th of March, we can clearly see the increasing concerns around mitigation. Not only is the overall plan for mitigation a good one, like the correct one, but actually the state of that plan as well. Throughout that week, I was of the opinion we should move faster, even within a let's call it an envelope of the mitigation strategy. That view hardened. We can see that I start writing that document basically saying we should change the strategy. Then you go to the SAGE meeting on the 13th of March, where discussions occurred, which leads me to what I've written here, that lots of people, including members of SAGE, did not think that the mitigation strategy was necessarily the right one.
Yeah, and that's the third point you make.
Yes.
Okay. We've heard from other witnesses about the meetings that then took place over the weekend, on the Saturday and Sunday. And may I ask you, for now at least, some fairly high-level questions about that. First of all, by the end of the weekend at least, was it right that a decision had been reached to change from a mitigation to a suppression strategy?
My memory of the Sunday the 15th meetings is I don't have a clear memory. I remember from the 14th there was it felt to me a prevailing view that we did have to move forward with the suppression strategy. However, obviously it needs to be discussed with Patrick and Chris. But I can't. I'm afraid I can't tell you with the certainty that I would like to be able to.
Well, it may be that my next question then is we'll get much the same answer, but we've heard slightly different evidence from people who were there about whether decisions in principle were taken at around that time about a lockdown or not. One thing is clear, no actual decision to impose a lockdown was taken then. We know that was some time later. But at least one witness, Lee Kane, said that he understood that in principle a decision had been reached over that weekend that there would have to be what we know as a lockdown. Others have made the point that that probably wasn't a word that was being used then, but we know what it means. But other witnesses, including Mr. Glassborough this morning, have said no, there were certainly decisions over that weekend about the range of more intrusive MPIs that were announced early in the week that followed, but not really any even decision in principle about a lockdown over that weekend. Can you help us with that?
I think my impression was that it was clear we were going to have to change the strategy, that we were going to move to a suppression strategy. From memory, on the 15th, that was also, and like I say, my memory of the 15th is very unclear as to, but I do think that my memory was that that was also the impression. As to the exact measures and what we now term as a lockdown, what was actually implemented, no, I believe that that level of specificity wasn't discussed. I mean, you can see that in some of the pictures that I've taken of the whiteboard, that, you know, those options are actually the things that ended up developing. So that we were discussing things on the 13th and 14th that then, you know, became what lockdown. But I understand that, you know, this is an important question. I'm afraid I can't answer more than I've done.
Yeah, no, well, you've been very helpful, Dr. Warner. Let me ask you, please, about a document around this time, although it was a WhatsApp message between Mr. Cummings and Mr. Johnson. If we could go, please, to 48313. Thank you. It's ahead of me. Just look at that. So there's a message from Mr. Cummings on the right-hand side to Boris Johnson, where he says the main problem is not them, and he's referring to Chris Whitty and Patrick Vallance. They and Sage are doing a great job on the science models. The Warners have interrogated, one of which is you. The problem is Cabinet Office and DHSC haven't listened and absorbed what the models truly mean. And then this, and timing-wise, you've been told a bunch of stuff based on time to peak, but not time to NHS collapse, which is an extremely critical difference. Now we can see that, actually I should have said, this is dated the 14th, so it's the Saturday. Do you agree with that sentiment, Dr. Warner, that in the period before that Saturday, that weekend, there had been inadequate attention on the question of whether, and if so, when, the NHS was going to collapse?
I agree with that entire message.
And in fact, we see that Mr. Cummings sort of emphasises it in the message below. He says that's what the Warners have been screaming at him. Was that metaphorically screaming, Dr. Warner, or actually screaming?
Metaphorical.
Let me finally then, just in a couple of minutes, ask you some more general questions, and then perhaps it would be a good moment to take a break. I just want to ask you, as I say, some more general questions about the period up to that weekend. First of all, can we look at paragraph 303 of your statement, please, on page 78? As we have observed, one thing we can say about the period running up to this weekend is that throughout end of January, but certainly February and the first part of March, the policy was one of mitigation. And really that was what everyone was thinking about. And at paragraph 303, the last 2 or 3 lines, you say, from early 2020, we should have developed alternative plans, for example, lockdowns, after seeing the actions in China, or at least after Northern Italy. So is your point, your reflection, Dr. Warner, that there was, if you like, too narrow thinking during that early period, or too much weight was placed on one strategy? What are you trying to get at here?
I think what I'm trying to say here is that for some diseases, we will want to use a mitigation strategy. For some diseases like HIV, we use a suppression strategy. I think that once we saw that other countries were implementing a suppression strategy, even if we felt that mitigation was currently the right choice for the UK, we should have started working up plans around suppression.
Why?
I think that the answer is that, well, actually, sorry, I can answer that more correctly. In a mitigation strategy, as we've seen, the problems that you have are really around horribly excess deaths, etc. However, in a suppression strategy, you need to bring in methods of control, so test and trace, testing. These things require time to start up. They require time to build. The capacity of the state, obviously, once we fail to contain, we know that the systems we have in place will not be able to do it for when the virus is higher. Therefore, for suppression, you do need to have plans of how you're going to increase your testing, how you're going to have increased test and trace, how you're going to do many of the other things that we found we had to do in COVID to suppress the virus and stop it spreading throughout our society.
Thank you. So that's the sort of practical reason why one needs to think about a suppression strategy early. I wasn't very clear, but what I had in mind in asking you about why you need to think earlier is that one of the criticisms that has been suggested of the SAGE system is that it depends on providing these consensus statements, whereby it is, as it were, a summary of everything that people don't disagree on. And the suggestion has been made that one consequence of that system is that one doesn't find in SAGE documents, certainly the statements, a variety of options. And so one doesn't, for example, see, well, a group of people think this, a group of people think that, and yet another group thinks you should be thinking of something even different again. Do you think that it was that requirement always to find consensus on something that perhaps led to the suppression strategy being left out of account in those early months?
I do worry we're reading too much into the idea of consensus statement there. As you see in my witness statement, I try to suggest that we should bring in similar consensus statements around other things, like how people are behaving, what are done in lockdown. Because actually I think the idea of taking very complex sets of data, very uncertain data, and bringing it together so that a person can have an informed view over 1 or 2 pages is actually a hard task, and it's important. And I think that idea of making sure that people have 2-3 pages of insight rather than data is actually important. If we were just feeding people the data that's by we're seeing, I mean, I'm not going to be able to understand that. I do think that to say that the consensus statement is the error, because actually they are, sort of showing people what is going to occur. I think that the interface into COBRA, into DHSC, how that was interpreted, I cannot speak to. But I think this idea that the SAGE is that is speaking to the SPY-M statements on the SAGE minutes, how they flow into the system, what is the right way to transfer complex scientific opinion into departments they fully understand. My personal opinion is the way you do that is high bandwidth conversations between experts. You'll see throughout my witness statement, I'm always worried about the lack of epidemiology in government. I sent an email to Simon Case saying the first thing I'd do when he became PERFSEC, saying the first thing I'd...
Just slow down a little bit.
Apologies. The first thing I would do would be to ask Angela McCain to join, because of the fact that actually high bandwidth communication between experts is how you confer that uncertainty, you confer that disparate. So I think it's almost, it's weirdly, in discussing how maybe by moving to SAGE statements, the bandwidth compression leads to a not full information. I'm worried in that simple statement we're doing the same thing.
Yeah. I just want to take you back, though, to this paragraph. You are quite clear that in the view that more should have been done to think about a suppression strategy earlier than in fact was the case. I asked you whether you thought that one explanation for that not happening was the consensus system, if I can put it that way, and I think you've said no, you don't think that's the problem. Are you able to identify what went wrong in the fact that the suppression strategy wasn't considered as early as you think it should have been?
I think we can all look at, you don't need, as we talked earlier, complex models to look at the activities China was taking or the activities that were going on in northern Italy and think that we should have alternative plans. That's the statement I'm making as to where those plans should have been constructed, who should have made the decision to construct those statements. I'm afraid I'm not the right person to ask for that type of thing.
Okay. One last question, perhaps, before we have a break, Dr. Warner, and it goes back to the question on reflection of consideration of NHS capacity. And we saw in that WhatsApp that Dominic Cummings was saying that, if you like, Boris Johnson had been given the wrong aiming point, or at least hadn't been given that important aiming point of time to NHS collapse. I've taken you through the chronology, admittedly fairly swiftly, of your understanding of the position vis-à-vis the NHS, including the starting point of exercise Nimbus. Do you think that more consideration should have been given to the whole question of NHS capacity during that period? And if so, by whom?
I think that there is a clear difference between a reasonable worst-case scenario and the forecast. How that forecast is made, who is in charge of what is the right plan, I think is an important question, and one of the reasons why I think the inquiry is so important. As to the consideration of the NHS, I think that that it is correct that many reasonable forecasts from at least, let's say, March the 8th, where I talked about an IFR of 0.25, 0.51. All of those numbers roughly come down to the idea of an NHS that is almost certainly overwhelmed, even if not overwhelmed, under incredible stress. And I think at that point, it's clear to everyone that more thought, and at least, at the very least, as Angela McLean talked to me, she said to me, do you know that, do you think senior decision makers know what this strategy is saying? I remember that because she used the phrase, the only way out is through, as in once you're on a mitigation path, you have to stick to the path. And I think that even from the March the 8th, I do not think that was given the consideration it deserved.
That leads to what I promise really will be my last question, Dr. Warner, and it's this. Another of the themes of the evidence we've heard from those scientists who were sitting on SPI-M and SAGE is that I think really throughout, well, certainly for the early part of the pandemic, certainly in this period, they said that they didn't really have a proper understanding of what the government's policies, priorities were, which made it difficult for them to do their work, their modelling and so on. Do you think it's possible that they didn't realise in this early period that the overwhelming of the NHS would be unacceptable to the government, and that that's perhaps one reason why more wasn't said about this on the SAGE side earlier?
think we have to be careful drawing inferences on where mistakes occurred because of the fact that I don't think I have any evidence. I do think that Sage did understand. Whether that was translated into the government plans and the government plans updated given what Sage was saying, I think is an important question, but I'm not sure I have that much to add to it beyond what I've put in my witness statement.
Just to be clear then, are you saying, and we're not asking you to say things that you don't know or draw inferences that you're not comfortable with, but you were there and we weren't. Throughout, are you saying that from the time you started attending Sage, which was the middle of February, it was commonly understood that the NHS being overwhelmed would simply be a red line and couldn't be allowed to happen?
No, I don't think that. No, I think that I don't know if the government's plan had specificity of that type at that point. So whether Sage wasn't aware of it or whether that specificity did not exist, I cannot speak to.
All right.
I think you had enough final questions before
I wasn't
the break.
proposing to ask even a single one. The final question, my lady. May we have...
I'm sorry we have to break, but I think it's for everybody's benefit. But we will finish your evidence this afternoon, I promise, Dr. Warner. 20 to 4, please.
All right.
Mr. O'Connor.
Dr. Warner, I'm going to move on the chronology to the summer and autumn of 2020. But the theme at least picks up on something we were discussing before the break, which is the evidence that we heard from some of the Sage scientists, at least, that they found there to be a lack of government policy that they could sort of receive and understand and use as a baseline for their advice, modelling and so on. And it may be that what we see in your statement is a wish that there had been perhaps more of that sort of carefully thought through strategy, starting perhaps at this sort of time, this period around the middle of 2020. If we could look at paragraph 304, please, on page 78. I'm going to pick up on the second sentence. You say, throughout the COVID-19 response, not enough resources were devoted to alternative plans and measures that strategically reacted to potential developments in COVID-19. Government's just-in-time policy making exposed the lack of expertise within teams, as the speed meant that it was difficult to pull in the appropriate expertise from outside. And this speed also forced a reliance on visualizations of data rather than rigorous quantitative analysis. And then in the next paragraph, you say that the decisions on the second and third lockdowns you think were correct at the time they were made, as it were. But, sentence starting, however, you say, I do believe we could have done more to prepare for these scenarios. So is it the case, Dr. Warner, that you felt at this time that more could have been done, as it were, by way of sort of strategic planning rather than just reacting to events?
Apologies, by at this time you mean?
Well, I'm focusing on the period from the sort of middle of the first lockdown, where thought is being given to emerging from lockdown through the rest of the year. But you tell me if you think that there was a different time when strategic planning should have been.
Sorry, I just wanted to. The statements you've just read out, I agree with.
Can you expand on them? What is it that you're sort of driving at that you think should have been done, wasn't?
I think that increasing the capability and the capacity within government on analytics, science, software engineering, would have allowed those teams to have greater resources, greater headspace to a space to apply themselves to key problems or possible future developments, and that would have allowed us to meet the challenges of winter with a more robust strategy, have plans in the locker, as it were, as to what happens, rather than having to react and trying to come up with, as I say, sort of policy just in time.
Yeah, you do pick up again on this idea of need of planning at another section of your statement that I'd like to take you through, and that's paragraph 164. And you may recall, Dr. Warner, this is the passage where you refer to the two sort of opposite ends of the spectrum in a way, the running hot policy of allowing infections to reach sort of an almost unsustainable point, as opposed to zero COVID, trying to keep them extremely low. And you suggest, and this is towards the bottom of this paragraph, that you think it would have been better to have tried to identify, rather than running between those two extremes, tried to identify what were the best and most effective NPIs, where, as you say, the best means maximum effect on suppressing the pandemic for the minimum cost. Is that something you feel either wasn't done at all or wasn't done enough, again, in the sort of middle period of 2020?
I think that was the ambition from May onwards. I think whether that was accomplished, and to the degree it was accomplished, I think is what I'm referring to in the paragraph that you wrote before, you read out before.
And are you saying it wasn't achieved as well as you think it should have been, or as much as you think it should have been?
Yes.
Let's just look, again, you wrote a few documents around this time trying to capture this point, and I want to show you one of them, which is INQ 195939. Again, it's not dated, but I think it's sort of around about April, May of 2020. Is that right?
I believe I sent it to Simon Case when he first became PermSec, and in that email I say I sort of wrote this 5 weeks ago. So I don't know when Simon became PermSec.
I think that's where I got my dating from. But is it right, in summary, that what you're exploring in this paper is this question of what's the, I think it may have been referred to with another witness as smart NPIs, or what's the most effective NPI that we can, or see a combination of NPIs
Yes.
that we can arrive at?
I think that is crucial. It's the system of NPIs that, in particular, I'm focused on in this document.
And we may see the best description of this if we look on the second page of this document, where you say, in order to lift the measures, that's the coming out of lockdown,
Yes.
we need to replace them with other measures that have a similar effect on the epidemic, but a lower cost to society more broadly, economic, societal, public service, health, and so on. Just pausing there a moment, we'll come on to see that you say more about those sorts of other impacts of a lockdown. We have, for example, so far today, you and I spent a lot of time talking about the epidemiology, the infection rates, how many people are dying, and so on. Here you are mentioning the other negative impacts of lockdown. Well, were those things considered throughout the period we've been discussing, so from the start of 2020? Did they start to become considered more around this time in April and May 2020?
I think that from March 14th, we essentially started to construct a plan of suppression. In the time period while we're trying to build the plan out of lockdown, apologies, I can't remember the name of that one that released, so I think it was sort of mid-May, we're trying to push towards this idea of, okay, how can we control the virus but mitigate the harms that, everyone was very aware of.
The economic and societal harms.
Yeah, and public service and health, yeah. these harms were talked about.
And if we see in this list of 3 points you have that we have on the screen here,
I think it might be 4, and I've just mistyped.
well, we're looking at the first 3 anyway.
Sorry about that. I meant economic, societal, public service, health.
I see. Well, I was going to move on to the 3 numbered points.
Oh,
You've
apologies.
referred to. Don't worry. You're describing there, aren't you, in these numbered points, this way of sort of integrating and trying to achieve the most effective combination of MPIs.
Yes.
And in particular, the point 3, you refer to the small, crucial, vulnerable groups who are indirectly affected, and trying to make sure that their interests are not missed in designing the best possible combination of MPIs. Is that what you're trying to say there?
Yeah, I think that when we're thinking about the system, we're trying to make sure that we don't harms are inflicted lots across society, and not inflicting them on our group, maybe because 2 measures inflict their harm on a similar group of people, and that means that group of people is seeing the full harms compared with the rest of the system. That's what I'm trying to say there.
Yeah, and we can see that the examples you give are, well, the second is domestic abuse, about which we've heard with other witnesses. You talk about household quarantine. Do you know what you meant? I mean,
I think what we're saying there is people who are having to isolate in a situation where we would, in a situation where there's domestic abuse going on.
So this all seems very important, Mr. Warner, and points like giving careful thought to the impact on these vulnerable groups and so on is obviously, perhaps obviously, the right thing to do. You are talking here quite strategically. It's sort of blue skies thinking. How much were these sorts of principles taken up in the actual decision making in Downing Street in the weeks and months that followed?
Here, I'm trying to suggest a sort of a systematic approach to this problem, and about thinking about it as multidisciplinary teams. My opinion is that there's lots of expertise, policy, science, analysis, and putting those people together in a team is very effective. And actually, the sort of standard government silos is not necessarily the most effective way, in my opinion, of working. And so I'm trying to pitch a slightly different way of working into government and how it thinks about these problems.
We're going to come on to talk about your proposal for a COVID-A, a sort of analysis team. Is that the sort of thing you've got in mind here, or not?
I think that they are looking at different problems. Here, what I'm trying to suggest is, for this problem of how do we improve the system of MPIs, that's what this is looking at. The COVID-A is more about the fact that policy it takes us time to write, and the analysis for that policy takes longer. The analysis that database is based on, so the collection of that data takes even longer to build, especially if you have to collect it and there's a time sequence to it. So for COVID-A, I'm talking about the leadership and the decision-making structures as to, what is the appropriate data infrastructure to build, what should the analysis be done, that has to be done 8 weeks in advance for a decision that might be needed for the policy. So they are all around trying to push forward how government thinks around analytics, but one is around a specific problem and the other one is around how do we lead and organise as a sort of a group.
Before we leave this, though, Dr. Warner, back to the main point, which is that things didn't work out quite as neatly as this. MPIs weren't finessed and thought through deeply with a sort of a well thought through combination of measures being imposed. Perhaps you'll say they were, but the scheme that you're suggesting here, do you agree, wasn't something that worked, at least in full, in practice?
It wasn't implemented.
And was that because that events just made it impossible, or do you think that it could have been and should have been implemented?
I think every person has their own opinion on what is the best way to organise. In the end, the COVID task force organised along more traditional sort of government lines of policy delivery analysis. I don't think we ever got to the bottom of, it was a continued vexing question in February as to what is the most effective system of NPIs. So I think that the system that we had in place didn't quite manage to do it. However, whether this would have accomplished, which is what is a very hard task, I think I can't speak to whether this system would have worked.
No. Let's move on, please, Dr. Warner. And we're going on towards the autumn of 2020 now. We all know what actually happened. We know that there were calls from the scientific community for a circuit breaker lockdown. You were still attending SAGE at this time, I think, so you would have known all about that. We know that, at least initially, that is not what happened. Rule of 6, local tiers, and so on. And I want to ask you to look at some WhatsApp exchanges that you had over this period with Lee Kane, who has given evidence to the inquiry. And I'm going to show you them and then ask you about them after that, if I may. I'm on page 3. You see them on the screen. Dr. Warner, do you see them?
Yes.
And they're in 3 little time groups. So I'll take you through them each and then ask you about them all together, if I may. So starting about 4 or 5 lines down from the top, on the 18th of September, do you see that? You saying, I feel like you and I walked out of COVID in June, walked back in today, and literally nothing has changed. Lee Kane says he agrees, and you say mad. So there's an exchange in the middle of September. Moving forward almost a month into October, the 12th of October, Lee Kane says, we're so fucked. Lee Kane says, why are we not acting in London and urban areas now? Same errors as March. You say, agreed. Feel like we are where we knew we would be 3 or 4 weeks ago. Lee Kane says, should have done a circuit breaker and still should. Half term might be too late. London will soon be out of control. And then if we can go down 2 or 3 more lines, another fortnight or so to the 30th of October, you say, I feel like we've accidentally invented a time machine. Lee Kane says, oh, mate, and then I can't take this insanity. Now, so over a period of a month or a month and a half, 3 short exchanges, you'll see they have similarities. You both seem to be saying and agreeing, perhaps, that not enough lessons have been learnt from experiences earlier in the year. Perhaps that lockdowns should have been ordered earlier. Can you tell us, if necessary, looking at the 3 exchanges in turn, but what you thought around this time and whether these exchanges reflect your thinking or not?
I feel that these WhatsApps are indicative of what I was thinking, but not necessarily the best evidence. I think that it's clear in... can you scroll up to the top so I just get the dates right?
Yes, so the 18th of September.
Yeah, so actually earlier than that, if we're honest, that we had a rising problem with infections. Infections were rising. Indeed, I believe if you... and so, and when I say to Lee, we walked out in COVID in June and walked back in today, and what I'm saying is that the capabilities that we discussed earlier, actually, track and trace, things like that, did not manage to stem the virus. Our knowledge of what MPIs were most effective was not that much more advanced. So essentially, the decision-making that was occurring... Actually, the one thing I would say is here we do have the ONS infection study. It's an excellent piece of analytical work, which actually allows us to be very clear when we're talking about infections rising. When we talk about we knew where we were 3-4 weeks ago, that's predictions of the ONS infection study. This is basically, we are seeing that infections will keep rising until you do something.
So expand on that a little, but was it really therefore your view that the best use hadn't been made of the time from, say, April, May through to the autumn?
I detailed, sort of in my witness statement, some of the things on that period, and some of the things that I think we could have brought in better, some of the ways we could improve the analytics.
Yeah. What about this idea that there should have been a lockdown in September, October? I think perhaps, in fact, you and Mr. Kane may not have had quite the same view on that matter.
I think I refer to this in my witness statement. Yes. So not having that in front of me, I think my answer would be that there are probably two arguments for let's say increasing the stringency of measures for a short period. The first is that the obvious effect that might have on infections. The other is that maybe that increases public awareness, maybe moves people behaviour towards behaviour you want, maybe more people work from home, etc. My opinion at that time was that infections would continue to rise unless we brought in more stringent measures. So I believe that I was of the opinion that actually it was about bringing in measures that we felt we could hold for the whole of winter because they would be necessary, not necessarily bringing in stringent measures and then going back to as we were today. So I think that was my opinion at that time.
Yeah. You do describe in your witness statement that when the time came for, in the end, Boris Johnson imposing the second lockdown at the very end of October, you actually thought that a more extensive, a longer lockdown should have been ordered than was in fact ordered.
I believe what happened was at the end of the meeting that I refer to in my witness statement, I actually argued both sides of the lockdown, both a pro-lockdown argument and an anti-lockdown argument.
Go on.
I think that in November, if you have a 4-week lockdown, I believe, rule of thumb, 1 week of lockdown, 2 weeks of lockdown moves you back let's say 1 week. So you moves you back 4 weeks. So let's just say that if you lock down in November, you end up at the end of September. Well, in the end of September, we're arguing for lockdown, right? So essentially what you're arguing for is you're back in an area where you were arguing for measures anyway. That would be the argument against the lockdown. Well, it basically says, sorry.
I think
I'm sorry, I've lost myself. Let me start again. I'll try and be a bit more clear. A 4-week lockdown will reduce infections, let's say, just rather than trying to do math in my head under pressure, back to, let's say, late September. In late September, Sage were arguing that we need to bring in measures. Therefore, actually, that's an argument that a 4-week longer lockdown is not long enough to...
Inadequate.
Yeah, exactly. Now, obviously, lockdowns bring with them tremendous harms. Therefore, if you think the lockdown, as to use your words, was inadequate, is that an argument for actually maybe the lockdown, the harms of lockdowns are more? So it isn't to say that I thought that the lockdown was the wrong thing to do. As I say in my decision making in my document, I think it's done. I think that these are complicated, hard decisions where there is, uncertainty on how people behave, what will actually happen with how how much infections will drop, etc.
Yeah. But just before I leave this, coming back to the point you made earlier, what we've been discussing is that decision made at the time. But for the reasons you've already given, there are things which you say could have been done much earlier in the year, which might have prevented the need either for lockdowns at all or for lengthy lockdowns later in 2020.
Sorry, I'll have to read, but I think I'm trying to say that you might have to lock down, but we'd alleviate some of the harms, which isn't necessarily the time under lockdown. It's clear that there are, lots of people and lots of bits of there are costs to a lockdown across, as we discussed earlier, the health, people's health, public services, the economic costs, the social costs, and actually we could have maybe brought in measures to mitigate those, even if the exact sort of length of lockdown and the measures stay the same.
Yeah, I see. Thank you. Let me move on to a slightly different issue, Dr. Warner, and that is towards your analysis of data during the pandemic. And to do this, let's look at page 42 of your statement, paragraph 150, first of all. Because the first point you make, which is certainly something we've heard from other witnesses, was simply about the relative unavailability of data in the early phase of the pandemic. And you give an example of SPI-M struggling to access test and trace data. Well, first of all, can you expand on that problem briefly? And do we infer from your reference there to the early stage of the pandemic, to the fact or suggestion that this was a problem which got better or resolved later on?
Data sharing is a problem, an acknowledged problem in government, how you do it. We shouldn't overlook that there are reasons that, we need to protect people's privacies, etc. In that period of time, we're also running, there's another set of work around how we might be able to improve data sharing. In these cases, like SPI-M not struggling to access the track and trace data is obviously a problem that creates an uncertainty in their model that doesn't need to be there. I'm sure there's other teams across government that don't have access to data that would have been useful to them.
So that's an issue relating to simply the availability of data. If we could look on at paragraph 152, though, you say that your main concern was not, by inference, this question of availability of data, but rather that the analysis work was too shallow. You say you felt that too often that is, the analysis work, contained a large number of quantitative judgments where no evidence was shown, and too often included graphs with unlabeled axes or which were unreadable, and so on. Elsewhere in your statement, you use this phrase, the importance of providing insight rather than or before data.
Yes.
Are these similar ideas that you're referring to here?
Yes.
And can you expand on what you saw as being your main concern in this regard then?
I think that analytical work is hard. It needs teams to have the right time, space, data, capability, also expert knowledge. I think that that's and often that those teams didn't have that, which meant that they were trying to do the best that they could given the capabilities, capacities, time they were able to, rather than the piece of work that we would all think would be appropriate for that moment in time.
On a similar theme, Helen McNamara, when she gave evidence, talked about an overemphasis on what she described as countable things. I know you've looked at that paragraph of her witness statement, and the problem being that other issues, things like domestic abuse or even things like older people being isolated, because they didn't sort of register on the figures, were overlooked. Is that a similar issue, do you think, to your critique about insight rather than data?
Yes.
And help us. I mean, we're looking forwards. If we have another situation like this, what would you recommend for change? How should things be done differently to try and provide more insight next time?
I think that it's important to recognise the dashboard was a very important product that served a very important need that allowed decision makers to have up-to-date information on the crisis at that time. But like any tool, it should not be used for every single purpose. For instance, I'm not sure what Helen means by not showing up in the data, whether she's saying it's a perceived risk, whether there is evidence of this occurring, but not in the data that is being shown in the dashboard, or that there isn't any data on it. All those things could be true. But I do think that for the future it's important, and this is where we speak to sort of COVID-A. It's about what is the right tool, the appropriate tool for the problem we're trying to solve, and making sure that given that lens, do we have other lenses on the world to ensure that we think we've got a proper view of the situation, of the priorities, and to make sure that we understand as best as we can what the evidence is before we make a decision.
And I think her suggestion was that certainly dashboards, as you say, were very useful, but perhaps they should include other areas of these sort of richer picture items, as well as hospital capacity and so on.
I think that the way I would look at it is that modern dashboards, we can build automated systems that very quickly flow the most recent data to number 10. The speed at which analysis or policy or information flows to number 10 is through traditional processes, people emailing private offices, emailing, etc. So what I would suggest is, that what we need to do is build out similar toolkits that allow us to make sure that decision makers have the appropriate information on risks like this, or alternatively, make sure that decisions are taken at the right level where that information is known. And that is the other side of the same coin, but looked at from a different way.
Sticking with data, Dr. Warner, but moving on to a slightly different issue. You were obviously very immersed in all of these data issues during the pandemic. When did it become obvious to you, on a data perspective, that there were ethnic disparities or disparities in the experience of different ethnic groups appearing in the data?
I remember discussions in SAGE to this effect, but I can't give you an exact date.
So that's the SAGE, probably February, March, noting that the hospital data probably was showing up differential experiences. Was this something that was taken forward in terms of the dashboard, or trying to develop these sort of data analytical techniques at an early stage, or not?
I don't know what was in the dashboard. The dashboard has a large range of information.
Was it something, whether it's on the dashboard or in other terms of data exploitation, that you had personal involvement in?
I don't think I did, no.
Or experience of?
I don't have any memories of that.
Do you, sitting here now, have any sort of reflections on whether enough was done to capture or analyse the disparities that emerged during the pandemic?
As discussed in my statement, I think that our data collection, our analysis, our ability to spend time to look for that was weak across the board. And I think the reason that is important, we strengthen it for the very issues that you're raising now.
Let me move on to another issue, and that's economic advice and modelling. For these purposes, can we go to page 79 of your statement, please? Paragraph 309. You say that you felt the biggest absence throughout the pandemic was the lack of economic modelling in decision-making. You say that HMT, who is responsible for economic modelling, has a strong set of policy officials, but when it came to your interactions for all aspects of your work in government, you found that HMT was severely limited when it came to specialists in science, advanced analytics, technology or data. Now, in June 2020, you chaired a seminar at Number 10 touching on these issues. I think it was called The Economics of Lockdown. I'm going to take you to an email about it in a moment, but, well, let's look at the email and then I'll ask you the question. It's 235261, please. This is, in fact, an email from Claire Lombardelli, who gave evidence this morning. She was at this seminar. You're not copied in on the email. I think it's an internal HMT email. We'll look at the content of it in a moment, but can you give us some evidence from your own knowledge about how this seminar came about, who arranged it, what was its purpose, and so on?
I don't remember how it's set up. I think it's very unlikely that I set it up because I had very good relationships with the Bayes data science team, who I knew were doing a lot of work in this area. Therefore, if I was to organise a seminar of this type, I'm almost certain I would have involved them.
Can you give us any clues as to who set it up? Can we assume it was set up at the Number 10 end of things rather than, for example, by the Treasury?
If it was, from the email, it looks like it was not set up from the Treasury, and therefore the other two people in the room were Simon Case of Number 10 or Patrick Vallance, and of those two, well, your guess is as good as mine.
All right. Well, let's look at the email. Claire Lombardelli is, as it were, reporting back to her colleagues, isn't she? She says she attended an odd seminar with the above title. Well, how much memory do you have of the seminar now, Dr. Warner?
Almost nothing.
All right. She refers to it. The cast list was the below, and I think she's referring to the, if we scroll out, it's the addressee list for the email below. Seems to suggest that Chris Whitty may have been there, and Simon Case, and someone from the Bank of England, and also Patrick Vallance. Does that sound right to you? Or perhaps you can't now remember.
I would trust the email list over my memory.
Yes. But certainly it seems to be, we can see that it's some people, a high-level discussion. Yes? The Cabinet Secretary.
I believe
he was a permanent secretary in the Cabinet Office.
But yes, agreed. If you're looking at 4, maybe 5 perm secs in that meeting.
Yes. Then this. The discussion very familiar. The economists all did a very clear pitch on smarter NPIs being able to deliver the same level of virus control at lower economic cost. She refers to a paper. There was a general conclusion by economists that the economics is not being considered enough and a desire for a place to bring this together. They posed 3 options. 1, an economic sage. 2, a single model. 3, something more informal. Pausing there, as we've just seen, you also felt that more economic modelling, more economic analysis ought to be being done, did you?
Yeah, I mean, that's probably why I was invited to this.
So carrying on reading, we said that Claire Lombardelli states the economists obviously killed the single model. We asked her this morning why it was so obvious that the economists killed the single model, and in summary she said, well, it's just not achievable to have a single model which takes into account both epidemiology, health, economics.
I believe that there is one.
Well,
I believe that that there is I think it's called Open ABM, that I believe Goldman Sachs helped build.
We've also heard, Dr. Warner, from someone called Professor Keeling at Warwick, that during the pandemic he started and did produce a model which addressed both epidemiological factors and at least some economic factors. But does it seem obvious to you that the idea of a single model is hopeless?
I think that it's important to recognise that forecasting the economy is incredibly difficult. Forecasting an epidemic is incredibly difficult. Although it might seem hard, given the costs of lockdown, I think it's worth at least a good try, especially given that there did seem to be groups out there who were trying it.
Certainly the view of Professor Keeling, who had done this work during the pandemic, and also Professor Woolhouse, another epidemiologist who gave evidence, we saw his email at the beginning of your evidence, was that this is something that ought to be worked on before the next pandemic, the more sophisticated models that could draw these factors together. You're not telling us that that's a fool's errand.
I think that it's important that we don't think that the next crisis will be exactly the same. In my opinion, that upgrading the capability within government to be able to build out models of this type, to be able to engage intelligently with academics, bring people in, and bring the most of our quantitative the possibilities using quantitative modelling to bear on the problem is crucially important. But I would look at this not as we should be building our model, more we should be building the people and the structures and the capability to be able to do that for any future crisis.
Yes, well, that's a useful caveat, but I think it's actually not far from what Professor Keeling and Professor Woolhouse were saying, because, as you say, there's no point in building the precise model you would have used last time now, but you want to be able to have that capability swiftly if another pandemic hits.
Dr. Warner, can I ask a question? Sorry to interrupt. Looking at, if we could scroll down to the passage which says there were some useful tidbits, CBI have data. Just highlight that passage. Am I being simplistic in this approach? You see the reference to hospitality, 20 to 30% operable at 2 metres, 60 to 70% at 1 metre. Can you find that?
Yes.
Most in the sector need 70 to 80% capacity to be viable.
Yes.
Now, as a simple soul, I'd think, right, okay, so if 70% of hospitality, if hospitality needs 70% capacity to be viable, and they can operate 60 to 70% at 1 metre, I would then want to know as a decision maker what would be the impact of having a 1 metre rule rather than a 2 metre rule. Is that too simplistic?
I often find with analytics, actually the most simple reading is actually the most sensible reading.
And would that kind of data or analysis have been with the decision makers back at this time?
I mean, no, I think that. I think I agree with you. That is the reading. I don't know if that very simple information would have been with decision makers. But I also think it's important that 60 that says they have capacity to be viable. Well, actually, the other option is how can we increase their capacity? For instance, outdoor spaces. How would that have made a difference? So I think that is the level of analysis that we need to push to not just taking given the current state, but what can we do to get to a better answer to mitigate the harms? And I think so. I would agree with you. And I don't know if this was made available to decision makers.
Sorry to interrupt.
Not at all, Lady. Coming back to just in fact the paragraph just above the one we were just looking at, Mr. Dr. Warner. We talked about the economists obviously killing the single model. Reading on, it says some liked the idea of an economic sage. It was agreed that Ben Warner would follow up with Ms. Lombardelli, Patrick Vallance, and others. 2 questions. First of all, did you like the idea of an economic sage? And secondly, did you follow up with those people about it?
So, I mean, I think that Yeah, I think I am of the opinion that the government doesn't make enough of their expertise that exists across the UK, whether it's in the academic sector or in the private sector. I think SAGE is a fantastic initiative, though science is the high watermark of government using the resources of the whole of the UK to bring to bear on a problem. So I think that obviously to me that economics similarly would be useful. The exact and precise method of doing that, to say whether it should be a SAGE-strike structure or maybe having economics with a specialism working with departments, I'm not an expert on economics. I won't be able to tell you exactly the right docking mechanism, but obviously having the very thoughtful people working with government is a good idea.
One view, and this was a view expressed by Mr. Glassborough when he gave evidence, is we've got the Treasury. It's stuffed full of economics experts. This is what the Treasury does. It provides economic analysis and advice to government. So why would you need an economic SAGE? You'd just be duplicating things. What's your view about that?
I think that leaving aside my view of what the capability of the Treasury is, obviously having a diversity of viewpoints is important. Obviously bringing outside expertise is valuable. I think there is to say that you know everything about such a complex problem as I don't think Stuart was saying this, by the way, but I think that obviously there is expertise to be had within our academics.
Did you follow this idea up at the time?
Yes.
And what happened?
So I believe the series of events is that Patrick Vallance suggested sectorial teams, and I believe Claire Lombardai might have replied, saying, yes, that's a good idea. I made, I believe, an argument for using for a single model. I don't know past that. I don't think it would have been appropriate for me to set up this type of body. I think that I'm not an economist, and I don't have an inbuilt knowledge of government departments, the best way to lock it in, etc. But I do think an economic SAGE would have been, or no, I think us making more use of our academic sector across the piece. I mean, I don't think we should specialise just economics. There's other people. For instance, I had a very interesting talk at one point with a health economist who I tried to dock into to testing, because I think the more people we get in, and also the more resources, right? I think that throughout the time in COVID, we saw that the capability and the capacity of the academic teams was they were struggling at times, and giving them that extra resource would definitely be helpful. You know, our academic sector is packed full of really talented people, and we should always be trying to use them in government.
Can I show you a related document, Dr. Warner, and it's INQ 302264997. This is a recently published, it's April of this year, recently published report by the Institute for Government. We can see it's entitled The Treasury During COVID. I'm going to take you to one or two passages in this, but perhaps before we do, it's important to understand, did you have some input into the research for this paper?
Yeah, I believe that the team that wrote this paper talked to me before writing this document.
All right. Well, I'm going to ask you about one or two passages in here, and when I do so, you can tell us whether the subject matter is something that you spoke to the team about. We don't want to have a sort of echo effect. It may just be that we can look at one passage. If we can go to page 6, please. This is the executive summary chapter, but at the bottom of the page, please, final paragraph, we see the report says, when it came to more in-depth economic analysis, for example, predicting the potential economic impacts of different policy options or projecting how economic behaviour might respond to a renewed spread of the disease, the Treasury shared information much less effectively with the rest of government, particularly in 2020. And then this, senior Treasury officials also vetoed proposals from other departments to establish a cross-departmental group to discuss economic impacts and the proposal for a socio-economic version of SAGE, which could have fed external expertise into government in a more systemic way. First of all, was this an area of their research that you spoke to the researchers about?
I'm afraid I can't say with any certainty.
All right, well, leaving that to one side then, can you help us understand this suggestion that plans for economic SAGE, which we just saw being discussed at the seminar and in that email, may have been vetoed by senior Treasury officials?
I think that Treasury would have been the appropriate place for an economic SAGE, in the same way GoScience is the appropriate secretariat for the scientific SAGE. It did not occur. That's all I can. I got the vetoed could mean an active veto or a passive veto, and I don't know which one the Institute of Government is referring to here.
Well, let me just ask you about your own experience. Dr. Warner, you were the person looking at that email who was tasked with trying to take this forward. You've told us you tried.
Sorry, I didn't want to give the impression that I tried to set up an economic SAGE. There was follow-up to that. I don't think I would have been the appropriate person to set up an economic SAGE. I don't even know who are what are the best economic departments in the UK.
I see. All right, well, let's just look at one more angle on this. It may be that it helps, maybe it doesn't, but it's an exchange, a WhatsApp exchange you had with Tom Shinner, who worked at the Cabinet Office, did he not?
I believe Tom Shinner was brought into Number 10 to help with the tracking of projects.
Right, so a Number 10 rather than the Cabinet Office. If we can look at 269187, please. Page 17. So we note that this is, and it's towards the bottom of the page. Yes. So I'm showing you where it starts depressingly. So let's just note the date. We've gone forward a bit. It's February 2021. So I think it's Tom Shinner who says, depressingly, I think there's quite a lot of truth in this about the Treasury approach. And you say, I'm waging my own small war against HMT. Their culture is fucked. My new favourite line whenever they mention VFM, value for money?
I believe so, yes.
Is, well, it's only X% of eat out to help out and probably won't have such a terrible effect. What were your views about the HMT's culture in February 2021?
I think that HMT, in some ways, they have a very strong culture that enables and empowers their officials, and that culture is very effective for some things they do. I think that culture becomes and that has a positive effect, but I think it has a negative effect when it comes to places where special technical knowledge, like I mentioned around like advanced analytics, data, technology, and I think in that areas it creates a negative effect. Also at this point, I think that we are discussing with Head Treasury around the use of the toy model, and I feel like they, as my witness statement documents, that I was concerned that the Treasury were not necessarily providing a neutral set of information for the Chancellor to make decisions upon.
Yes, well, that is something that's in your witness statement, but I'm not going to go into it with you in detail now. But just sticking with this idea of the culture, you've referred to matters that are, as it were, internal to the Treasury, that their resources, their analytical capability, what they were doing or not doing properly with the toy model. Is it possible that your rather jaundiced impression of their culture also relates to their co-working and the way in which they were or weren't working with other government departments and Number 10?
I think that a open, transparent culture is always crucially important. I think that I had that working with numerous other organisations and groups. I think it is also important to mention, though, that for some of my interactions with treasuries, this message is true. However, in other areas, they were unbelievably helpful. They were thoughtful, and really helped. For instance, they actually seconded a couple of officials into 10DS to help us around the spending review. So I think it's important that, you know, when we reflect on these WhatsApps, that we're seeing a specific view at a specific point of time about, you know, one issue, but it doesn't necessarily reflect my entire views of what is a complex organisation.
Thank you, Dr. Warner. We can take that down. Just one further quick issue, and then I want to ask you about COVID-A. The quick issue is about an entry in your diary referring to long COVID. So can we, sorry, I said diary, it's a notebook, another one of your notebooks. Can we go, please, to INQ 264429? And it's if we go to, right, we've gone straight to that page, which is fine, Dr. Warner, because you've looked at this book and the other pages of it, haven't you?
Yes.
And so we see there about 5 or 6 lines down, a line which says infections up, long COVID. I want to ask you a few questions about that in a moment, but before that, are you able to help us roughly estimate the date on which you wrote that entry?
I believe from discussions earlier we decided it's about March 2021.
Right. We can see just below that it certainly seems to have been before June of whichever year you were in, because you are wondering what's going to happen on June the 21st. So the main question was it 2020 or 2021?
You can see just above that it says, maybe spelled incorrectly, efficiency of AZ, which I think is referring to the AstraZeneca vaccine.
Yes. And there are other references in the book which make you think that we're certainly in the first few months of 2021 rather than 2020.
Yes.
So with that in mind, here we have a reference to long COVID then in the spring or thereabouts of 2021. Can you help us with any more context or information about why you wrote that, what was in your mind, what considerations perhaps were being discussed at the time?
I'm afraid that my recollection of this meeting, I don't know what meeting this is, I'm afraid, but it's clear that this time we did know about long COVID, and if infections increase, then even if we don't see deaths, then long COVID is obviously another thing to bear in mind.
Right. All right. Well, I'll leave that there. And then finally, can we please go back to your witness statement and to paragraph 288 on page 75. And you refer here, Dr. Warner, to a retrospective meeting which happened in February 2021.
Yes.
And we will remind ourselves that I think it was May 2021 that you left.
Yes.
Was that, as it were, a planned date? Did you know in February of that year that you were coming to the end of your time or not?
I believe so at this point.
Because what we'll see is that there was a meeting which I think you instigated, involving senior decision makers looking back over the last year or so and trying to understand what had gone well and what hadn't gone well.
Yes.
And I wonder whether that was partly because you knew you were coming to the end of your time, or maybe that's not the case.
I think that I was always trying to improve how we could improve analytics, improve data. I think that it's important to realise that these are, there's a lot of people doing different things, some of which fall within the government, some don't, ONS, and how we can enable and empower the teams is always important. I actually did a similar lessons learned exercise in September, to try and make sure we understand, making sure we're listening to those teams so that when we're talking from the centre, we're actually talking about the problems they have, not the problems that we believe they have.
Yeah. But this was, as we've said, a little bit further on in February,
Yes.
hosted, as we see here, by Simon Case. And if we look at paragraph 290, we see the list of attendees: Patrick Vallance, Chris Whitty, Claire Gardner, Susan Hopkins, Claire Lombardelli from the Treasury, Ian Diamond. So a group of senior individuals from different government departments.
Yes, I would say the senior technical, the senior analytical leadership of our COVID response.
And let's look, if we may, just at there are a number of documents that we have relating to this meeting, but I want to take you to the Chair's brief for it, which is, thankfully, we have it on screen. And again, a number of issues that were discussed. I'm going to ask you, if we can turn to page 2, just about a few questions about one of the themes, which was around governance and decision-making structures. Before I do that, can you just give us an idea of, in more general terms, what the purpose of the meeting was, what the sort of scope of the issues that were to be discussed was?
If we just flick back one page,
Yeah.
we see the idea of a retrospective, which is a well-known thing that is done often within software development teams, where it's basically just trying to uncover the mistakes that are made, and as the sort of retrospective sort of, I'm going to call it a creed, says, whatever we discover, we understand and truly believe that everyone did the best job they could, given what they knew at the time, their skills and ability, the resources available, and the situation to hand. So what we're trying to do here is say to teams, actually, it doesn't help us by playing some sort of blame game. Actually, we know that improving analytics is important. We know this is a complex thing. We need to make sure that everyone's... And so it's trying to promote that open, truthful, transparent culture that actually allows us to discuss the issues and move forward with solutions rather than play some sort of blame game, etc. Which I don't want to anyway further the senior leaders, but it was just an idea that is done in software development that we thought might be valuable here.
Yeah. And so if we can go over the page then, the first of the themes that was to be addressed was governance and decision-making structures. And to be clear, this is a document which was drafted before the meeting, wasn't it, which detailed the advance thoughts that the people who were to attend the meeting had submitted.
So I believe that I talked to a large number of different people across the entire analytical landscape, including more junior members, because I think that's also important that we're not just sort of talking to senior leaders. These people lead large organisations. So that's where my comments come from. And then the senior leaders themselves, I think, put forward a document as to what they believed. And I think that Simon Case's private office had some very good officials who constructed this document together to provide him with the best possible speaking notes so that he could lead the meeting.
So that's the genesis of it. And we can see that the obstacle then is identified as there being no forum to set the long-term analytical plan, to prioritise resources, to drive operational action or evaluate programmes. The comment, which I think is your input,
Yes.
says you feel this is where a lot of the other problems stem from. This meeting is necessary and needs to be hosted by the Cabinet Secretary is itself evidence of the lack of this forum. And then we see comments by others, including from Patrick Vallance, commenting that there has been at times a lack of clear reporting lines for SAGE in the absence of COBRA. And also Rob Harrison, for example, who was a Director General at the Cabinet Office, I think, referring to a general lack of proactive, longer-term thinking. So were these the problems to which you thought that COVID-A was the answer?
Yes, I think that, as it says there about the prioritisation of resources, the data infrastructure that needs to be built, where's the best place to put our software engineering talent at that point in time? Those decisions, there was no forum for that. for also discussing other problems that these teams were happening. There was no forum. So that's my idea of a COVID A is it's just sort of like, well, there's a COVID operational, there's a COVID strategy, so COVID analysis.
Did you, I think it was created, a COVID A, was it not?
I don't know what the energetic force of this meeting and what actually ended up doing to a degree.
Let's not worry too much then in any event about what happened last time, but looking forward, can you see that this is a sort of gap which might need filling in future situations?
Yes, I think that I think it's important to realise that to build data infrastructure takes a large amount of time investment. To do analysis takes time. Therefore, you need some body that's saying, okay, given the amount of resources we have, we need to focus on this problem, or to be able to move in the right set of talent for the period in time. For instance, if you need, at a certain point, you might need data engineers to onboard the data, but then you might need to bring more data scientists in, and you might be able to remove those data engineers to another problem. So that ability to flexibly bring in your talent to focus on the priorities at the moment, given with a long-term vision in mind, I think that senior analytical leadership and how that is done for these type of cross-government problems. Obviously, departments are doing this within their own sort of digital and data teams, for instance. But how do we do that for the cross-government problems, I think is what I'm talking about here.
Yes. Dr. Warner, thank you very much. Those are all the questions I have for you. There will be just a few more questions for you.
Ms. Mitchell?
I appear as instructed by Amar Anwar and Company on behalf of the Scottish COVID bereaved. Dr. Warner, I'd like to ask you some questions about data, in particular availability of data. The inquiry has already heard a little and probably will hear a lot more in later parts of this module that there were problems obtaining data from devolved administrations and that efforts were being made to resolve these. In particular, that devolved administrations thought they were unable to share data on COVID because of GDPR. And we understand that efforts were being made to obtain legal advice to explain to them that that wasn't the case. Were you aware of these difficulties in obtaining data from devolved administrations, particularly in relation to the Scottish Government?
Across government, data sharing is an issue, and then also how the statistics is done across the devolved administrations. I don't believe I'm aware of those specific areas, but in general, those are problems that occur for not just COVID, but many other government problems.
And we heard about that in your evidence so far. I suppose it stands to reason if there are problems getting data, it impacts upon the problems of analysis. But can you identify for us, were there any specific impacts upon areas of devolved administration that impacted upon your work?
I think that, as discussed previously, whenever you have a lack of data, it means that you can't focus on those problems. So the problems that you've mentioned about that existed around devolved administration, I'm sure, hindered the ability to analyse that data and then produce the necessary information to decision makers.
And was that something that you found where you hindered in that regard?
In my role, that type of level of specificity around a data source would not be what I would look at. We tried to set up we set up a data sharing team within the central GDS, which I think moved to the CDDO office, to try and give teams that are struggling with those issues a set of experts that could give them advice, including legal advice, to try and address these exact problems.
following up from that, can I ask whether or not you're aware of the person who was involved in liaising with the Scottish Government in that regard? So perhaps we can follow up and ask that person.
I'm afraid I don't.
Would you be able to find that out for us?
I'm afraid that the question you're asking is very important. It depends on the exact nature of the data, where that data, which department it sits in. So that would be the place to ask, is the department that was interacting on the issues that you are worried about. And it could be actually multiple departments, which speaks to why data availability in government is sometimes very hard for these cross-government issues.
Thank you. Thank you, my lady. Those are the questions that I would like to ask.
Thank you very much indeed, Ms Mitchell. That completes the questioning. Dr Warner, thank you very much. I'm sorry it's been a long afternoon for you answering such questions and with such care. Obviously, you've been very careful with your answers. Thank you for all your help, and we shall resume tomorrow at 10 a.m. Thank you.